What is Miplyffa? Miplyffa Arimoclomol is a medication for Niemann-Pick Disease Type C NPC to improve neurological symptoms and stop disease progression. Miplyffa may help to improve speech, fine motor skills, body movement, swallowing, and cognition, thinking, understanding, and learning. Miplyffa capsules are taken 3 times daily and are used in combination with Miglustat Zavesca capsules. Niemann-Pick disease type C is caused by a genetic mutation that affects lysosomes, which are part of the cells that transport material into cells and break them down. Changes in the genes NPC1 or NPC2 stop cholesterol and other fatty substances, lipids, from being able to be transported inside cells. This means that lipids build up in areas of the body, including the brain, causing problems with speech, cognition, swallowing, movement, and fine motor skills. It is not fully understood how Miplyffa works, but is thought to improve the function of lysosomes by reducing unesterified cholesterol in the lysosomes of NPC fibroblasts and upregulation of coordinated lysosomal expression and regulation clear genes. Miplyffa FDA approval was received on September 20, 2024 for the treatment of neurological manifestations of Niemann-Pick Disease Type C NPC in adult and pediatric patients 2 years of age and older. It is to be used in combination with Miglustat. Amplify Assist is a support program by Zevra Therapeutics Incorporated for patients and caregivers with NPC who are taking Miplyffa. The program provides clinical education, insurance coverage support, access support, and help with prescription fulfillment. Miplyffa side effects include upper respiratory tract infections, stuffy nose, sneezing, sore throat, diarrhea, weight loss, tremors, hives, headache, lower respiratory tract infections, and seizures. These side effects occurred in 8% or more of patients in clinical trial 1. Serious Miplyffa side effects are hypersensitivity reactions, including urticaria and angioedema. This is not a complete list of side effects, and others may occur. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Warning: hypersensitivity reactions, including urticaria and angioedema, have been reported in patients treated with this medicine in trial 1. 2 patients, 6%, reported both urticaria, hives, and angioedema, swelling of the eyes, lips, genitals, hands, and feet. And 1 patient, 3%, experienced hives alone. These reactions occurred within the first 2 months of treatment. In patients who develop severe hypersensitivity reactions, discontinue Miplyffa. If a mild or moderate hypersensitivity reaction occurs, stop this medicine and treat it promptly. Monitor the patient until signs and symptoms have resolved. Increased creatinine without affecting glomerular function in clinical trials of Miplyffa. Mean increases in serum creatinine of 10% to 20% compared to baseline were reported. These increases occurred mostly in the first month of treatment and were not associated with changes in glomerular function. During Miplyffa treatment, use alternative measures that are not based on creatinine to assess renal function. Increases in creatinine were reversed upon Miplyffa discontinuation. Embryo-fetal toxicity: Miplyffa may cause embryo-fetal harm if taken during pregnancy. Based on findings from animal studies, females should be advised of the potential risk to the fetus and consider pregnancy planning and pregnancy prevention. How should I take Miplyffa? Take or give capsules exactly as instructed by your healthcare provider. Your healthcare provider will tell you the number of capsules to take or give for the prescribed dose. Miplyffa capsules can be swallowed whole with or without food. If you or your child have difficulty swallowing capsules, they can be opened and can be taken or given by mouth by adding 15 milliliters of water, apple juice, applesauce, yogurt, or putting in a small cup, stirring well, and swallowing straight away. Through a feeding tube, see package insert for full instructions with diagrams. The inactive ingredients are not water-soluble and will remain undissolved if the contents of the capsule are added to beverages or soft food. If you miss a dose, skip the missed dose and take or give the next dose of Miplyffa at your regularly scheduled time. Miplyffa dosing information. Miplyffa recommended dose is based on weight. Miplyffa dose, 8 kg to 15 kg, 47 mg 3 times a day. 16 kg to 30 kg is 62 mg 3 times a day. 31 kg to 55 kg is 93 mg 3 times a day. Heavier than 56 kg is 124 mg 3 times a day. Miplyffa capsules are available as 47 mg, 62 mg, 93 mg, and 124 mg of Aramoclomol. Before taking this medicine, pregnancy, tell your healthcare provider if you are pregnant or planning to become pregnant, as Miplyffa may cause harm to your unborn baby. Breastfeeding, tell your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if Miplyffa passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take Miplyffa. Infertility, this medicine may impair fertility in females and males of reproductive potential, based on findings from animal studies. In an animal fertility study, oral administration of Aramoclomol resulted in decreased male and female fertility at 9-fold and increased pre-implantation loss at 5-fold the human exposure. It is not known if these effects are reversible.